The open space, the fresh air. I love being outside.
Well, I grew up in Montana. I went to high school here in Billings, and these are my people.
I think it's a great place to work. There's a lot of support for the physicians.
It's a very good outdoor community, and for a town this size, it offers all the amenities that we enjoy.
Living in Billings is a wonderful place to raise a family.
Because I love hiking, I love camping, I love all that outdoor stuff, so it's been a great place to live.
I love skiing and wildlife and hiking and fishing and those types of things. And when you compare Montana to other parts of the country where you can get that, we're unique in that we don't have the crowds. It's easy, it's accessible.
We have a little bit of everything. And again, it's a way where you could have a career and you have balance in your life and you have time to raise your children.
For a young orthopedic surgeon coming out of training, the first thing you want to know is there a need? And we have a need for services here because we have a very large service area. You've got the infrastructure in place to come and have a practice with a carpet kind of rolled out in front of you before you ever arrive.
I think people here really care about our patients. We care about other people. We see our patients as individuals.
The staff here is very, very people-oriented, and of course St. Vincent's, initially a faith-based hospital, really has a focus on that aspect of care and humanity for people. And it just carries through the relationship and the attitude that people have.
I don't think you'll find a more committed group at any healthcare facility. The physicians, the nurses have a calling for their duty.
I like to get to know my patients and see them and often have a relationship of 5 years, 8 years, 10 years, and then also often getting to know their family members.
I think what sets us apart is the fact that we really try to understand people and where they're coming from and their background and try to get into their shoes for a bit.
You're most of the time going to figure out diagnosis by listening to what they have to say rather than just relying on an x-ray or a lab test.
People that choose to work here usually are here because they have a sense of calling, a sense of compassion and caring for patients.
No matter what job people are doing, people have pride. People are happy working here. They enjoy making a difference for people. So I like being here.